Hi and good afternoon. My name is Aurora Villarreal, and I am the presenter today for this TriFold. It is on data analysis of HRRP. This is a course at the Texas State University for Health Information Management graduate course for 5320. Let's go over the introduction. Healthcare is a crucial part of our everyday life, from having a simple cold to paying our health insurance. There are many different variables that make up what healthcare is. Section 3025 of the Affordable Care Act is one of those variables. The Hospital Readmission Reduction Program, HRRP, helps reduce excessive readmission payments, specifically the payment reduction of 3%. In addition, the HRRP conducts the excessive readmission ratio, known as ERR value, to evaluate the performance on the following conditions: acute myocardial infarction, chronic obstructive pulmonary disease, heart failure, ammonia, coronary artery bypass, graft surgery, and elective primary, total hip arthroplasty and or total knee arthroplasty. This program was passed due to the nation's goal of improving health care by linking payments to the quality of hospital care. Therefore, this paper will cover data on excess readmission ratio, the number of discharges, and the number of readmission in the hospital in the United States. Let's continue with the background. Before we dive into the topic of HRRP and excess readmission, some research was first established, specifically 3 journal review articles. The first article's objective was to evaluate the financial penalty of HRRP on 3 factors: pneumonia, acute myocardial infarction, and heart failure. By using a secondary data analysis, data was collected from 3,395 non-federal hospitals that reported data on pneumonia, acute myocardial infarction, and heart failure. For the calculation of readmission ratio for the fiscal years 2013, 2014, and 2015, the researchers found that there was a significant decrease in excess readmission for those 3 categories, concluding that there was a significant effect on inpatient readmission in the following 3 categories. In the second article, the 3 values that were used to calculate an estimate of HRRP in hospitals in the state of Virginia are: in readmission over time between patients targeted by the policy and a comparison group of patients, and then compares those differences estimates in patients treated at the hospital with readmission rates above the national average. The third article objective is to see whether the HRRP has an impact on patient morality. This is a retrospective cohort study in pneumonia, acute myocardial infarction, and heart failure in the time frame of 65 years. A total of 8.3 million hospitals were evaluated in this study. They concluded that HRRP does have a significant relation to post-discharge of patients. All 3 articles had similar findings that additional research is needed to have a definite answer. However, all 3 prove that HRRP program does have a positive significance to what we call healthcare. The methods. As the researcher, I have selected to conduct a cohort study where one or more samples will be evaluated to see an outcome. The advantage of using this method is to analyze a relationship between the variables. This leads us to our research question. Is the number of discharges and number readmissions associated with the excess readmission ratio and HRRP? The null hypothesis states there is no association with the numbers readmission associated with the excess readmission ratio. The alternative hypothesis states that there is a significant linear relation with a 95% confidence between the number readmission associated with the excess readmission ratio. The data analyzed are hospitals in the United States with values of measured name, number of discharges, excessive readmission ratio, number of readmission, and with a start and end date. By using the SPSS software, there are three variables that were used. The number of discharges, excessive readmission ratio, and the number of readmissions were used to create a frequency statistical table and three histographs. These three histographs are presented in the results. In the second section of the data analysis, excessive readmission ratio value was inputted as the dependent variable and the number of readmission as the independent variable to create a descriptive statistical table, a box plot, and a normality plots with tests. This is also shown under the results as Figure 4 linear regression scatter plot. Figure 1, Figure 2, and Figure 3 are all histographs. Figure 1 covers a number of discharge, Figure 2 is the excess readmission ratio, and Figure 3 is the number of readmissions. All three figures have right skews, which means that the mean is greater than the median. No outliner is presented in all three figures. In Figure 4, which is a linear regression test, shows a significance between the values because they contain 0, indicating that the hypothesis should not be rejected at a 0.05 alpha level. Therefore, there is a statistical significance that has no effect due to the values equaling to 0. To sum up, the research question is number of discharges and numbers readmission associated with excess readmission ratio. This was proven by showing a strong relation as the flat line in Figure 4 in the linear regression scatter plot. With this in mind, more research needs to be conducted, like all three literature reviews concluded as well. Overall, HRRP does have a strong relation when evaluating the excess readmission return. Thank you for listening and have a great day.